So in today's video, I want to talk about Nubeqa. So this is a new drug that's come out on the market. We've had a lot of questions about it. People want to know where do they take it? How do they take it? Does it work? And we get to ask you. So what do you think?
It's an exciting new drug. This is a pill for men who have what they call M0 hormone resistance without metastasis, category prostate cancer. And the hope is that Nubeqa will turn out to be less or have fewer side effects than its competitors, which are Xtandi and Zytiga and Erleada. And it's not an easy thing to accomplish because those other medicines are actually quite well tolerated already. So it'll be interesting to see how it all plays out. It's just getting started, so we don't have all the information in yet. But it is certainly an important drug, as all these, we call them second-generation hormonal agents are. They are for men who have been on Lupron for many years and it stopped working and PSAs are going up, and the concern is that metastasis will be appearing in this near future unless you do something. The pill is taken twice a day, and the hope, as I mentioned before, is that the common side effects of fatigue and sometimes rashes and other issues will occur less frequently. It is an unproven premise, but we'll find out with experience.
Okay. So what's the mechanism of action, so to speak? Like, how does it actually work to fight prostate cancer?
So Lupron blocks testosterone in the testicles, and so when you test testosterone levels in the blood, when men are on Lupron, the testosterone levels are very low. And over a period of years, prostate cancer cells can actually learn how to make their own testosterone internally inside the cancer cell. Testosterone inside the cancer cells then can activate the DNA that causes replication and growth. So Nubeqa and these other agents block the switch inside the cell that testosterone turns on. And so even though there is now testosterone production inside these cancer cells, the testosterone doesn't reach the switch to be able to turn on growth. And it inhibits or causes cancer cells to regress or die.
So in the trial results from the Nubeqa material that I was looking at, it said that it delayed the progression of metastatic activity by 3.3 years. Is that like an average number? So when these clinical trials, can you explain that to patients, how they develop this number over time?
It is an average number. They're comparing to the men that got a sugar pill or a placebo, where the average time to the development of metastasis was like 1.5 years. And in the men that got the Nubeqa treatment, it was more like 2.5 or 3.5 years. The exciting thing that I like about these medicines is that in the clinical trials, they allowed men's PSAs to rise all the way up to 10 before they started them on treatment. And I expect that this medicine is going to work a lot better when men get on the treatment when the PSA is very low, say below 1. That's been our experience in my practice, is if these second-generation hormonal agents like Nubeqa and Xtandi and Zytiga and Erleada are started when the PSA is down at a lower level, like 1 or less, that the remissions seem to last more than just a couple years, but quite a bit longer.
So have you given Nubeqa in the practice so far? I know it's pretty new.
We've had a few people that have started on it. It's not had a long enough track record for me to really form an opinion, a first-hand opinion. The studies that have been done look favorable.
Okay. Yeah. And from the couple people you've put on, the side effects haven't, I know it's new, but they haven't seemed to be pretty severe at the beginning of anything? Or?
No, but most of these medicines are well tolerated. It's only a minority of men that run into side effect problems with these medicines, so you have to get exposed to a larger group of people before you have a sense whether there's any difference or not.
As far as the drug itself goes, how do you see this changing the prostate cancer landscape? Because, in previous videos we were talking about what the M0 space is, non-metastatic castrate-resistant. Do you see this helping prostate cancer patients kind of benefit from treatments in the future that they would probably get sooner had Nubeqa not been available?
Well, all the medicines that are effective in making people live longer open up the opportunity for people to grandfather into as yet undiscovered medicines. And I've seen this a number of times in practice where people will get a good remission to, say, something like chemotherapy, and then a new medicine like Xofigo gets approved, and then they respond to the Xofigo, and then at the time that the Xofigo is starting to run out of gas, then something like Zytiga gets approved, and it's kind of like catching a wave and riding these new discoveries to longer and longer survival.
That's a really good point, because I think that people don't typically think of prostate cancer as a chronic disease. They kind of have like the get it out mentality right away. So I think realizing that they're going to be benefiting from future medicine and future research, and that anything that's delaying that progression, it's not like after 3.3 years you die and there's no treatments left and there's no clinical trials left and there's nothing left. And so I think getting out of that mindset is really important. So I'm glad you brought that up. Thank you so much for watching this video. We really appreciate it. If you have questions you would like me to ask one of our prostate cancer experts in the future, you can go ahead and leave your questions below. And please, if you like this video and you appreciate the content, give us a thumbs up and also subscribe to our channel. Every subscription from any subscriber that we get helps YouTube pick us up, and then we become suggested videos for other prostate cancer patients who are looking and Googling prostate cancer all around the world. And this helps us spread the message of good prostate cancer information, and also empowering them to learn and take control of their case. So we really appreciate your time. We love you very much. And if you need any help, we're right here at PCRI.org.